Hi, my name's Melanie. I'm an advanced nurse practitioner and I work in the GP surgery in Chislehurst, Bromley. I live locally in Wilmington and my children go to school in the local area. I've worked in this GP surgery for the past 8 years and I've been qualified as a nurse for the last 26 years. After qualifying as a nurse, I initially worked on a ward in general surgical and general medical, plus some more specialist areas such as urology and cancer services. After a period of time as working as a ward sister, I moved on to be a Macmillan cancer nurse, particularly assisting and diagnosing and supporting patients suffering with bowel cancer. I then made the move 8 years ago into primary care, working in the GP surgery as a practice nurse. After doing this for a while, I worked alongside other advanced nurse practitioners and felt some of the skills I had gained from my role as a Macmillan nurse would be useful in assisting me to qualify. I then qualified 3 years ago as an advanced nurse practitioner and have been working here since. So what does an AMP do? An AMP is a qualified nurse that has undergone training at master's level in order to practice at an advanced level. What does this mean? It means that nurses that are AMPs have expanded their roles into more traditional roles that were previously seen to be solely GPs and doctors' roles. This would involve diagnosing acute illness, prescribing medication, investigating patients and referring onwards if needed. AMPs often also have specialisms. I, for instance, have diabetes. Other colleagues have specialised in contraception or minor surgery. Communication is an essential skill for all nurses. Caring for patients with ill health can be challenging. Therefore, as broad a work experience as possible, dealing with the general public is very useful, such as retail or caring sectors. If paid work is not available, accessing roles within the voluntary sector would also be useful. Working as a healthcare practitioner is always challenging. Therefore, developing new experiences or skills out of your comfort zone would be useful. All of these jobs and experiences would improve access and gain experience in working in a team effectively. Let me tell you about my typical week. I work 3 days a week. My day starts at 8 and ends approximately at 6 o'clock. I run 2 clinics, a morning and afternoon session, which are a combination of telephone, face-to-face appointments and email consultations. Between those clinics, I do home visits for housebound patients who need urgent review. I also have allocated time for administrative work and supporting the fellow nursing team. We have currently nursing and medical students within the surgery to support. We also hold regular team meetings to discuss clinical matters. What's the hardest thing about my job? Well, the days when you fail to meet the patient's expectations, such as improving the timing of a hospital appointment or helping someone who has severe illness, are difficult. Also, within this job, time pressure is high, but experience with this has helped me to become more efficient and cope in this situation.